I want to talk to you today about something that far too many people ignore until it's too late. Your kidneys. These two small, bean-shaped organs work tirelessly every single day to keep you alive and well. But most of us don't think about them until something goes wrong. Here's the truth. Kidney disease is often called a silent killer because it can develop quietly, without obvious symptoms, until it's in an advanced stage. That's why recognizing the early signs can literally save your life. I want you to feel empowered, not scared, and by the end of this conversation, you'll know what to look for, what steps to take, and how to protect your kidney health for years to come. Before we go deeper, let me ask you a question. Have you or someone you love ever experienced unusual swelling, changes in urination, or unexplained fatigue? I'd really like to hear your thoughts and experiences, so share them in the comments below. Your story might help someone else recognize a symptom they've been ignoring. Now, I know that when you hear kidney disease, it might feel distant, like something that happens to other people. But kidney disease doesn't discriminate. It affects men and women, young and old, people who appear perfectly healthy, and those who already have other health conditions. I've seen people who thought they were fine, only to discover their kidneys were functioning at half capacity. And the scary part is that the earlier you detect it, the better your chances of reversing or slowing it down. But if you wait too long, the damage can be permanent. So let's start by understanding what your kidneys actually do. You might think they just filter urine, but they're far more sophisticated than that. Your kidneys filter your blood, about 50 gallons of it every single day, removing waste products, extra fluid, and toxins. They also regulate blood pressure, control the balance of electrolytes like sodium and potassium, and even help produce red blood cells. When your kidneys are healthy, you don't notice them. But when they're struggling, the effects ripple through your entire body. One of the first subtle signs of kidney trouble can be changes in urination. Maybe you notice you're going to the bathroom more often at night, or you're producing less urine than usual. Sometimes the urine becomes foamy or bubbly, a sign of excess protein being lost through the kidneys. There could be blood in the urine, which might appear pink, red, or cola-colored. And yet, because these changes can be mild or come on gradually, many people dismiss them. Please don't ignore these signs. Even if they turn out to be harmless, it's worth getting them checked. Another red flag is swelling, what we call edema. This happens because your kidneys are no longer able to properly remove extra fluid from your body. You might notice puffiness around your eyes in the morning, swelling in your ankles, feet, or hands, or even an overall bloated feeling. This isn't just about appearance. It's a signal that your body is holding on to fluid it should be getting rid of. Fatigue is another common but often overlooked symptom. Your kidneys produce a hormone called erythropoietin, which tells your body to make red blood cells. If your kidneys aren't working properly, you may develop anemia, which means your body isn't carrying enough oxygen to your tissues. The result? You feel tired all the time, even after a full night's sleep. You may also feel weak, lightheaded, or unable to focus. Now, here's something a lot of people don't realize. Kidney disease can also cause changes in your skin. You might develop persistent itching, which can be due to a buildup of waste products in your blood. Your skin might become unusually dry, or you might develop a yellowish or sallow tone. These changes aren't just cosmetic. They can signal serious imbalances in your body's chemistry. Nausea, vomiting, and loss of appetite are also potential signs, especially in more advanced stages. When the kidneys can't clear toxins efficiently, they build up in your bloodstream, a condition known as uremia. This can make you feel constantly sick, change the way food tastes, or even cause an ammonia-like taste in your mouth. It's your body's way of telling you that something is seriously wrong. Shortness of breath can also be linked to kidney disease. Sometimes this is due to anemia, but it can also happen because extra fluid builds up in the lungs. If you notice you're getting winded doing everyday activities, it's important to get checked, especially if it's happening along with other symptoms I've mentioned. Another thing I want to stress is that high blood pressure and kidney disease are closely connected. High blood pressure can damage your kidneys over time, and kidney disease can cause high blood pressure to get worse. It's a vicious cycle. If you've been diagnosed with hypertension, you should be extra vigilant about kidney health, because the damage can happen silently. Some people also notice muscle cramps, especially in the legs. This can be due to imbalances in electrolytes like calcium and phosphorus, which your kidneys normally help regulate. While cramps can have many causes, when they happen alongside other symptoms, it's worth investigating. One of the most dangerous things about kidney disease is that you might not have any symptoms at all in the early stages. That's why regular screening is so important, especially if you have risk factors. These include diabetes, high blood pressure, heart disease, obesity, smoking, a family history of kidney problems, or being over the age of 60. If you have any of these risk factors, I encourage you to ask your doctor for simple tests to check your kidney function. A blood test for creatinine and an estimated glomerular filtration rate, (eGFR), along with a urine test for protein, can tell you a lot. Now, I know talking about possible health problems can feel overwhelming. But here's the encouraging part. Kidney disease is not always a one-way street. In many cases, if it's caught early, you can slow its progression or even stop it. That means paying attention to your body, speaking up when something feels off, and committing to healthy habits. Lifestyle plays a huge role in protecting your kidneys. Staying hydrated is essential, but don't overdo it. Too much water can be harmful in certain kidney conditions. Eating a balanced diet that's low in excess salt, sugar, and processed foods can make a big difference. Controlling your blood pressure and blood sugar if you have hypertension or diabetes is absolutely critical. Regular exercise, quitting smoking, and maintaining a healthy weight all support kidney health. Medication safety is another important point. Some over-the-counter pain relievers, like ibuprofen or naproxen, can be harmful to your kidneys if taken too often or in high doses. Always follow dosing instructions, and if you have kidney concerns, talk to your healthcare provider before taking new medications or supplements. Stress management matters too. Chronic stress can raise blood pressure and cause inflammation, both of which can harm your kidneys. Finding ways to relax, whether through meditation, deep breathing, yoga, or spending time in nature, isn't just good for your mental health, it's good for your kidneys too. If you're already living with kidney disease, working closely with your healthcare team is the best thing you can do. Follow their recommendations on diet, medication, and lifestyle changes. Get your lab work done regularly so you can track how your kidneys are doing. And most importantly, don't lose hope. I've seen people improve their kidney function with the right interventions. Another thing I want to emphasize is the importance of understanding your numbers. If your doctor gives you your eGFR or your creatinine level, don't just glance at it and move on. Ask them to explain what those numbers mean. The eGFR is a measure of how well your kidneys are filtering blood. A normal eGFR is usually 90 or higher, though anything above 60 is generally considered okay if there are no other signs of kidney problems. If it's below 60 for 3 months or more, that could be chronic kidney disease. Creatinine is a waste product in your blood that your kidneys should filter out. Higher levels can indicate reduced kidney function. Knowing your baseline numbers is like knowing your blood pressure or cholesterol. It gives you a point of reference, so if things start to change, you can act early. Don't be afraid to keep a personal record of your lab results. That way you're not relying solely on memory or the assumption that no news is good news. Let's talk more about prevention, because it's not just about reacting to symptoms. It's about protecting your kidneys before there's a problem. First, limit excessive salt in your diet. Too much sodium makes your kidneys work harder and can raise blood pressure, which is one of the biggest drivers of kidney damage. Read nutrition labels, cook at home when you can, and flavor your food with herbs, spices, lemon, or vinegar instead of reaching for the salt shaker. Next, keep your blood sugar in check. High blood sugar damages the tiny blood vessels in your kidneys, which can lead to diabetic kidney disease. If you have diabetes, this means monitoring your levels regularly, following your treatment plan, and aiming for steady, healthy ranges. Even if you don't have diabetes, be mindful of how much added sugar you consume. Those sodas, pastries, and processed snacks can slowly set the stage for future problems. Protein is another interesting piece of the puzzle. Your body needs protein to stay healthy. But in people with existing kidney issues, too much protein can actually strain the kidneys. This doesn't mean you should avoid protein altogether, but it does mean you should choose quality sources and aim for a balanced intake. Lean meats, fish, eggs, dairy, beans, and lentils are good options. If you already have reduced kidney function, talk to your doctor or a dietitian about the right amount for you. And let's not forget hydration. Water helps your kidneys flush out waste and maintain proper balance in your body. For most people, drinking when you're thirsty and aiming for pale yellow urine is a good guide. But there's no one-size-fits-all amount. If you have heart or kidney problems, your fluid needs might be different. That's why personalized advice from your healthcare provider is important. Alcohol and smoking are two lifestyle choices that can harm your kidneys over time. Alcohol in excess can raise blood pressure and cause dehydration, while smoking reduces blood flow to your kidneys and makes existing kidney disease progress faster. If you drink, keep it moderate, and if you smoke, quitting is one of the most powerful things you can do for your overall health. Exercise is another key factor. You don't need to run marathons, but staying active helps keep your blood pressure, weight, and blood sugar in a healthy range, all of which protect your kidneys. Even 30 minutes of brisk walking most days of the week can make a big difference. Now, here's something people rarely think about. Your kidneys are also impacted by certain infections and medications. Some antibiotics, for example, can be hard on the kidneys, especially if they're taken for long periods. Certain herbal supplements can also be harmful, even though they're marketed as natural. Always let your healthcare provider know about anything you're taking, including vitamins and over-the-counter remedies. Monitoring your kidney health long-term isn't just for people who already have kidney disease. Even if you feel fine, getting a simple blood and urine test every year or two is a smart way to catch changes early. This is especially true if you have high blood pressure, diabetes, heart disease, or a family history of kidney problems. I also want to touch on the emotional side of this, because dealing with any potential health problem can stir up a lot of fear or anxiety. It's easy to feel powerless when you hear about chronic illnesses, but knowledge really is power here. If you understand your risk factors, recognize the signs, and take action early, you put yourself in the best position to protect your health. Sometimes, kidney disease can't be prevented entirely. Genetics and certain autoimmune diseases can play a role. But even in those cases, early detection and treatment can slow progression, improve your quality of life, and help you avoid complications. That's why I'm so passionate about this topic. If you ever experience symptoms like persistent swelling, changes in urine, unexplained fatigue, itching, or shortness of breath, I want you to think of them as signals, not annoyances. Your body is incredibly wise, and these signals are your invitation to check in, not to panic. Most of the time, there are multiple possible causes, but only a proper evaluation can give you answers. When you do see your doctor, ask direct questions. Ask if your kidney function has been tested. Ask what your numbers mean. Ask what you can do to improve or maintain your kidney health. You deserve to be part of the conversation, not just a passive listener. I've seen incredible stories of people who caught kidney disease early, made lifestyle changes, followed their treatment plans, and kept their kidney function stable for years. I've also seen the heartbreaking side of people who didn't know the signs and only found out when dialysis or a transplant became necessary. That's why I'm here. Because I want you to be in that first group, the group that gets ahead of the problem. So let's recap the signs you should never ignore. Changes in urination, whether in frequency, volume, or appearance. swelling in the hands, feet, ankles, or around the eyes, unexplained fatigue or weakness, persistent itching or skin changes, nausea or vomiting, loss of appetite, shortness of breath, muscle cramps, and high blood pressure that's hard to control. If you notice one or more of these, especially if you have risk factors, don't wait. Get checked. And remember, prevention is always easier than treatment. Keep your blood pressure and blood sugar in healthy ranges, limit excess salt and sugar, maintain a healthy weight, stay active, avoid smoking, drink alcohol only in moderation, be cautious with over-the-counter and herbal supplements, and stay hydrated appropriately for your body. I want you to walk away from this feeling empowered, not fearful. Your kidneys are remarkable organs, and with the right care, they can serve you well for a lifetime. You don't have to be a medical expert to protect them. You just have to be aware, proactive, and willing to make small, consistent changes. So now I'll turn it back to you. Have you noticed any of these signs in yourself or a loved one? Have you ever had your kidney function tested? I'd love for you to share your experiences in the comments. Your story could be the reason someone else takes action today. Thank you for spending this time with me. Remember, health is something we build every day, choice by choice. By recognizing the signs of kidney disease and taking steps to protect yourself, you're not just avoiding illness, you're choosing a stronger, healthier future. And that's something worth fighting for.